The Street Crisis Response Team is really looking at an alternative to law enforcement responding to individuals experiencing a mental health crisis.
It's just another way for San Francisco to reimagine providing care and services.
The Street Crisis Response Team was actually an initiative through Mayor Breed as well as community leaders who noticed that we could, I think, more effectively and compassionately respond to individuals.
The Street Crisis Response Team is a partnership between the San Francisco Fire Department and San Francisco Department of Public Health.
So the team is comprised of 3 different organizations, one being the San Francisco Fire Department with a community paramedic, a licensed clinician, and a peer counselor, which is myself.
The Street Crisis Response Team actually operates 24/7 throughout the city of San Francisco. Each team has designated neighborhoods. However, we can also respond within the neighborhood, but then we also respond dynamically. So we can respond to pretty much any crisis 24/7 throughout the city.
The 3 team members have a unique set of expertise and ability and training to be able to respond to individuals.
As a community paramedic, I am able to assess the person, provide emergency care, and stabilize them.
It's important to have a behavioral health clinician on the team because we are trained in order to support not only crisis de-escalation, but to support mental health treatment, mental health disorders, as well as substance use disorders.
As a peer specialist, I can relate to people that are in a crisis. And also I can understand people's distrust with institutions, and in turn I can offer a different approach.
The best thing that you can do if you see somebody experiencing a mental health crisis is to call 911.
The kind of calls that we get sent out to are someone having a mental health crisis in the community that are nonviolent.
When you call 911 for a behavioral health emergency, our dispatchers will be able to identify and select the most appropriate unit.
When we arrive on scene, the 3 of us assess the situation and decide what is the best practice for this type of call.
And so that could be supporting an individual to remain safely in the community. That can also be voluntarily transporting an individual to substance use treatment or to a shelter. And finally, in the rare case that we collectively determine that someone needs involuntary behavioral care, we can place a mental health hold, commonly referred to as a 5150.
After the team has visited with somebody, we try to find them again and do follow-up care.
We actually have a team that continues to support the individual in the community. And so that could be through continued linkage, that could be through continued support, helping them transition into whatever the next steps are for them. So really in the moment, we are responding not only to just the crisis and supporting an individual in that crisis moment, but we are also thinking about it long-term to really prevent the next crisis from happening.
We've already seen that this team is able to provide excellent interventions to support individuals and a lot of success in individuals connecting to care and leading successful lives and moving towards recovery and wellness.
When we're not actively responding to a 911 call or supporting an individual, we are driving around in our locations and engaging with community members and stakeholders to really try and build relationships and to foster trust within the community.
We have people that approach the rig all the time and know who we are by name and by face.
We know that the only way this program will be successful is if our communities trust us and we're able to support individuals the way that makes sense for San Francisco. So we're looking forward to expanding our work, getting to know who we're serving better, and continuing to provide the excellent care that we are.
If you see someone that's in a crisis, don't hesitate to call 911. We're here to help.